Hello, ladies and gentlemen. Thank you very much for joining me in this webinar here from my clinic in Ojai, California. Today's subject is on herbal treatments for headaches, according to Ayurveda, to the best of my knowledge and experience. In fact, headaches are probably one of the most tricky and hard to treat conditions there is. I would I'd be much more happy to have a straightforward condition like rheumatoid arthritis or osteoarthritis or just insomnia than headache, because the headache is really a symptom of a deeper imbalance, disorder, disease, deficiency, or inflammation, or even doshic imbalance. So there's so many causes of headaches. The real secret to treating a headache is the diagnosis of the causes. And it's very tricky to determine, and often there are many causes or more than one cause. So you can have compounded causes leading to your headache. So let's talk about, first of all, from the Ayurvedic perspective, because there's three major classifications of in headaches in Ayurveda. And this, of course, is going to be a Vata type of headache. This is from the person who has higher, Vata Prakriti or Vata Vikriti, person who's light, dry, cold, active, and rough. And this type of headache is going to be more throbbing, shooting, vague, and often comes during the dawn and dusk type of period, and it's more exasperated in the fall, in the early winter, as the weather starts to become cold. And often the Vata type of headache is accompanied with indigestion, gas, bloating, abdominal discomfort, and even constipation, which can contribute to it. And mostly the Vata headache we can see in the back of the neck and the lower spine, in the back of the head. So it's coming from the nervous system and coming up from the back. I mean, not to say that a Vata headache cannot also be have Vata and Pitta, so you can have the top of the head or the forehead as well. In the case of migraine, we have Vata pushing Pitta. We're going to cover that, where there's nerve. It's a nerve-based condition, but also it's more complex when it's Pitta. But for the sake of understanding the differences between these three types of headaches, or doshic causes. These are the causes are due to doshic imbalances. So that means if your Vata becomes too high, in the case of Vata Vikriti, Vrudi, where you're having high Vata, you're thin, light, cold, active. There's anxiety, nervousness, poor sleep, constipation, gas, and bloating. So we can see Vata is high. And then this type of headache, like I said, tends to be throbbing, moving around, coming and going, the dawn and the sunset, and more in the back of the head, or at least starting from the back of the head and the neck. We'll talk about a few home remedies later to help that. And of course, herbal treatments are very different. The second type of doshic cause of a headache is a Pitta. And a Pitta headache is often in the front temporal area around the eyes, and this can be exacerbated by heat, sunlight, and in the middle of the day, when 2 in the afternoon, when the sun is it's hot and the heat, and it's exacerbated in the summertime. And often people say that the bright light, of course, makes it worse and triggers a headache. And of course, part of the cure in this case would be turning out the lights and being in a dark room. But the headache is in the front around the eyes, and the eyes can often become red, and the temple area in particular can be inflamed, and the top of the head. Now, Kapha type of headache has more to do with congestion and cold weather, comes more in the spring, and relates to congestion in the nasal passages, and this creates a type of headache not up in the temporal area or the top or the back like Vata, but right around the head or the face, and particularly around the cheeks. And there's often breathing problems and congestion and respiratory conditions, and we see these in the springtime, and it can be, of course, triggered by allergies. So first you have to look at the headache in this light to understand and diagnose the type of headache. Is it triggered by nervous system, anxiety, nervousness, vata, lightheadedness, dizziness, or is it triggered by heat, anger, and more painful and sharp? Well, the kapha headache is more dull and heavy and doesn't change. It can just linger and has to do more with breathing, respiratory problems. So it's good to classify the headache first in this category, and often it's going to be very similar to the prakriti of the individual that you're treating, but not necessarily. But of course, there's many other causes of a headache, and not to say that you can't have say a pitta headache that also has a secondary cause, and that's why they're very difficult to treat. So, there's pathological headaches, we could call them, and that would be due to a pathological condition such as high blood pressure. When we see high blood pressure, we see red ears, we see veins around the temporal area. Sometimes we can see the eyes are bloodshot and the veins are protruding, and this type of person is having a headache due to the high blood pressure and possibly in combination with pitta or vata. So that's one example. But of course, if you had a tumor in the pituitary gland or the pineal gland, then this of course can be very serious and also could create a headache. There's also other types of headache we could call it referred headache. That means, for example, you have an infection, you have the flu, you have a fever. This often can create a headache. So, it can be treated for the symptoms, but the cause, of course, has to be addressed. And in this case, it would be the influenza, fever, or high blood pressure, as I mentioned earlier. And then another category of headache is related to like allergies, or we could say chemical sensitivity. This can come from poor air, poor ventilation, and even carbon monoxide poisoning, not getting sufficient oxygen through something hampering your breathing, either a closed room, unventilated room in a basement, or some type of mask that's inhibiting your intake of oxygen and accumulating carbon monoxide in the system. This also can lead to headaches. And of course, alcohol and tobacco can also create headaches. And, some people are even sensitive to wine, chocolate, hard cheeses, and sometimes these substances can also create headaches. Another cause of headaches, because like I said, we really need to diagnose what is the cause of the headache, and then we treat it accordingly. Just eye problems and eyesight problems can be an issue, like glaucoma. This is pressure, internal pressure inside the eye. This can also contribute to a headache, and it could involve, the person could have glaucoma, they could have high blood pressure, and they also could have pitta or kapha vikriti. So you have three causes you're dealing with there: having the lower blood pressure, having to balance pitta. And then, of course, ear infections can create temporal headaches. And also degenerative bone conditions, for example, osteoporosis, where you have degenerative bone, where there's low calcium, low minerals. And this often, another symptom besides the headache, is often ringing in the ears. And this is due to the fact that, our nervous system and ashidatsu, or our bone system and our bone tissue, are related. And if our bones are depleted, we don't have sufficient minerals, calcium, magnesium, to form proper bones, maybe through because of nutritional deficiencies of these minerals, then this can also lead to headaches. This is why some people, they get relief from magnesium. So, and that leads me on to another type of headache, and it's more we could call metabolic related. And this is where there's poor digestion, poor absorption, poor assimilation, which is very common. I think most clients, they have the poor digestion or malabsorption contributing to their health problems. And in that case, a person could have mineral deficiencies, like I mentioned, but also a B12 deficiency. And then we would see fatigue. And of course, blood work would indicate we have the B12 deficiency. But that's not B12, calcium, magnesium, even zinc can create this type of metabolic headache due to the fact that there's a nutritional deficiency due to poor absorption of food. Other causes include, of course, there's the migraine headache. Migraine headache is where we have more than one cause. We have vata, which is usually coming up from the spine, and then it comes forward and it increases pitta. So there's often pitta headaches are sharp, burning, very painful, like a migraine, but they also have the trigger of vata, the anxiety, nervousness, sensitivity is contributing. And of course, here we have inflammation of the arteries or dilation of the arteries, which is restricting blood flow and contributing to this headache. So migraine headaches generally have to be treated separately, and we could classify them again in pitta dominant or vata dominant. So just to wind it out here, I mean, a few miscellaneous causes of headaches would just be exhaustion, sunstroke, even misalignment of your spine. It's just straining your neck, just sleeping incorrectly on a pillow. And of course, withdrawing from any addictive substances. We all know that when we cut back on coffee, often we have headaches, but most addictive substances, when we withdraw from them, headache is a very common symptom. So, and that, of course, can be managed mostly by slowly withdrawing from the substance. And of course, toxicity being released through detoxification. Say a person has a lot of arthritic pain, joint pain, muscle pain, as in fibromyalgia or arthritis, and then we clean the joints, we clean the muscles, or a person has a lot of excess body fat and we're burning off the fat, the people are sweating out the water and losing the weight. Well, what remains is often the toxins, and we could say stir up these toxins in the bloodstream, with these herbs that are cleaning and the exercise that's, getting the system going and opening up all the channels and clearing out the bowels, and all of this kind of stirs up toxins, and then these toxins get in the bloodstream, and sometimes when you detox too fast, they sometimes call it a healing crisis, you can get this type of headache. So it just means you have to slow down on the detoxification process. And also constipation itself can be a cause of headaches because, when you're constipated, there's this type of autotoxicity taking place. Again, putting toxins back into the bloodstream. They're going past the blood-brain barrier, and then we're getting the symptom of the headache. So it's very important to understand that, there's many kinds of headaches. I mean, they also have different types of cluster headaches. There's headaches that can come from coughing, headaches that result from, just pressure in the head, even if the blood pressure is not high. There's headaches that can come from people not sleeping well, maybe because they're urinating 3 or 4 times at night, then they don't sleep well, then they have a headache in the daytime. So, each of these headaches needs to be treated accordingly and also in line with the person's, prakriti and vikriti, whether it's vata, pitta, or kapha. So, the cause of the headache and the doshic imbalances involved need to be identified first before you start treating it. There are some basic dietary guidelines, that help. A yoga and asana can help, but of course, don't do any type of inverted poses. This can increase pitta, increase blood pressure, and also increase headaches. But generally, we would want to avoid foods that that contribute to higher pitta, such as sour foods, spicy foods, fermented foods, and then foods that generally we have a lot of allergies to, like peanuts, mushrooms, foods that are too congestive, cheese, foods that are inflammatory, like tomatoes and chocolate. So it's important to understand even the time that you have the headache. So these are the types of questions that I would ask a client. Where is the headache? What time does it happen? What seasons do you get it? And often what triggers headaches? And we forgot to mention also hormonal headaches. I mean, a woman during her menstrual cycle could have a headache just due to a hormonal imbalance. And generally that's quite clear because the woman is quite aware that she only gets headaches during or prior to menstruation, so we know it's a hormonal imbalance. So let's start off with some general herbal treatments. If we were to pick the most common Western herb, I would say for a headache, we would have to say it would be white willow bark. White willow bark, of course, is the bark from the white willow tree, and this has been used for hundreds of years in Europe for pain, and it actually was studied by Bayer in the late 19th century to create aspirin. So, and he got the clue from the people drinking white willow bark because it functions like an aspirin. And also feverfew has been known to also help with headaches. It's anti-inflammatory and beneficial. And so a lot of these type of tension headache, mild nervines, and even mild sedatives like skullcap can be used as well to help to relax the nerves, bring down the tension, and take care of the headache. So we have a tea here. It's not treating these causes which we talked about, but it can be very helpful to at least eliminate the pain. There we have white willow bark for the pain, feverfew for the pain, and chamomile and skullcap, the nervines, and licorice root is kind of a catalyst, to help everything work together. It's very soothing and cooling. So this is very effective. It doesn't remove the causes, but it can take care of the headache for a few hours, and that can be very helpful. Other nervines that we'd get, if it was a vata type of headache, then we could also, and there's stress involved, we can give relaxing tea, and we have more nervines. There's the skullcap in there, lemon balm, catnip, lavender, oat straw, passion flower, rosemary, rose petals, and cinnamon. So this can also help to relax the nervous system. Well, I thought about it. There are a few good home remedies for headaches, and that's always important. One of the best, particularly when there's pressure in the head, is to put a cold water, a towel with cold water or just wet water around the neck and even on top of the head, and then put your feet in hot water, like a bucket of hot water. In fact, I just told this to somebody the other day, and in the morning they emailed me and said they did get to sleep after doing this, even though it's a lot of work. Getting a bucket of hot water, putting your feet in it, and then putting cold water on your head and a towel in the back of your neck.
Or the bathtub is hot water.
And then this brings the blood down to the feet and lowers the pressure in the head. It doesn't work for all types of headaches. It doesn't cure the long-term cure, but it does help. Other things, if there's a lot of congestion, eucalyptus steam bath can help. Even a massage can help. So there are, for pitta type headaches and vata type headaches, we can just focus on balancing the dosha. For example, if a person's red, hot, eyes are bloodshot, then we can just focus on balancing pitta. So we'd give a formula like this. It's called Pitta Balance, and it's reducing heat, acidity, burning, and fever, and it's using all cooling herbs like Kamadura, Pravapishti, Muktipishti, Pravapanchmit, and Guduchi Sattva. And this of Muktipishti, for example, is the powder of pearls, and Guduchi Sattva is most cooling of all herbs. It's a white powder that comes from the residue left of dried juice of Guduchi, and it's very cooling. And also just Shatavari can be used. Shatavari can be used to bring down the pitta. And then we provide a formula here. It's called Pitta Headaches, and this is for this type of burning. There it says, helps with hot frontal headaches, migraines, inflammation, excess body heat. And there we have that Shatavari, which I just showed you, Guduchi Sattva, which I just showed you, and Kamadura Ras, which is a formula, and Shank Basma, which is a type of powder shell. So that could reduce body heat and reduce this type of headache. Back to Vata headache. Vata headache, relaxing tea, maybe even sleeping tea with chamomile can help, supporting the nervous system, avoiding coffee, avoiding chocolate, avoiding stimulants, all can help. And of course we have other formulas. and herbs that can help with the nervous system. And that includes herbs like Jatamatsi. Jatamatsi is very is cooling. Shangpushpi, also cooling. Tagar, little warming sedative. So you don't want to give the wrong. Tagar is also called Indian valerian. So you don't want to give the wrong formula to a person. For example, if they feel hot, their eyes are bloodshot, and they're getting, they're sensitive to light, then we want to put them in a dark room, turn the light off, and not give them any heating herbs. Like some of those herbs I just mentioned are hot. Those are for a person who's cold, has poor circulation, cold hands and feet, has anxiety, and then we can give them these warming herbs like tagar and even cinnamon, even ginger, and put their feet in hot water, and even take and drinking relaxing teas to settle the nervous system, and hopefully they can sleep. Also, if we have another formula here, it's for anger. We call it cool head formula, but it also can help. It reduces irritability, frustration, anger, rage. But you can see that the herbs are Shangpushpi and Brahmi. Brahmi being probably one of the premier herbs in Western herbalism that can help with headaches. And Taruni. Taruni means rose petals. And there's a Jatamatsi, which I just showed you, Guji Sattva, which I showed you, and Mukti Pishti, which is the powder of pearls. So very nice formula there, very calming, but very cooling. And we use it actually for headaches. So if a person has bad headache and they're just like a road rage, I mean, they have a headache, they got anger all together, then this would be a perfect substance to just literally cool them down, because that type of person you could say is hot-headed, and they're very hot. Now the third type we could say is a kapha type, and has a lot more common. You're going to have respiratory problems, respiratory congestion. That's where you want to do the steam. You want to put a little eucalyptus oil in a bowl, put it in a sink, put some boiling, run hot water on it, and put a towel over your head, and and clean out the nasal passages and open up the breathing. In that case, in Ayurveda, we would use the formula Stipulati Churna or Talasati Churna. Both are used for respiratory congestion. Here's the formula which we'd use. So there we go. There you can see Talasati Churna. It's 8 herbs with Vasaka, which is a bronchial dilator, Tulsi, Guduchi, and Kantakari are all used. And this is for respiratory congestion, mucus, snoring, asthma, and productive cough. So in that particular case, if we know that there's congestion and there's this dull, heavy type of kapha headache triggered by respiratory congestion, no, we won't want to just treat the headache, which we could do with the tea, but we also have to address the cause, which is the congestion. And there's allergies too. There's cat allergies, mite allergies, dust allergies, and this is creating congestion in the nasal passages and leading to this type of heavy kapha headache. And in that case, we would give them like respiratory allergy formula. A respiratory allergy formula, we can see Shirisha is like an natural antihistamine, and Bringraj, Vasaka, bronchial dilator, Kantakari, good for coughing, Anantamule, soothing coughs, and cinnamon licorice are just a catalyst to make it work better. But the key herb is Shirish, and Shirish is a natural antihistamine. So it's modulating the immune system and the immune response and helping to avoid the allergies. So that's the main approach to treating headaches. And often I give out one type of nasya. A nasya is a type of oil, nasya. This is one from Banyan Botanicals. We have a few different ones. This one here is good for this type of case. It's called Calm and Clear. So it's got some calming herbs, but it also has a little vacha in it, which is opening up the channels, clearing. So for headaches, we generally always give one nasya, because we have some nasyas that can open up and others that can help calm the mind, others that can cool. We have, like, for example, Brahmi oil in coconut oil. So that would be good for pitta type headaches, because coconut oil is cooling. Even can put cooling oils on the head to help balance pitta. But in this type of case, for all headaches, the advantage of nasya is that we're able to reach the head and the brain quickly. So, but we have to pick the right one. Like I said, we have a few choices. If there's a Pitta headache, then we use Brahmi oil and coconut oil. If it's a Vata headache, then we use sesame oil, but we put in other herbs such as Brahmi, Shankpushpi, Jatamatsi, and maybe a little Tagar. Very similar to the relaxing herbs, but they're just in a base, a carrier base of sesame oil, and this is put in the nose. But this particular one here I'm doing is called Calm and Clear, and it's got some eucalyptus oil, and it's more for congestion and just opening up the nasal passages. You would lie on a bed and just take a little in each nostril. Not sit in a chair, but it's better to lie down and put that in each nostril. And the beauty of that is it's reaching this, the area of the body which we're trying to treat, and that is the head. Often we have some oils like sleeping oil or calming oil. They can be put on the head and around the forehead to help relax the body and bring down tension. And the same oil can be put on the feet. So there's certain oils that we use for like nervous oils or anxiety, and they also can be used for headaches if they're put around the head or even the bottom of the feet. And of course, if you have a tension type of headache, getting a full massage of oil massage with a type of relaxing oil can be very beneficial. So once again, I just want to say that the main way to address a headache, the real question is not, how to treat the headache, but the real question is, what is the cause of the headache? And again, there could be 2 or 3 causes to your headache. So these causes, and one of them is probably doshic, Vata, Pitta, or Kapha, and then there'll be other causes as well. So they all need to be identified. Most cases have 2-3 causes, particularly chronic headaches that people aren't able to get rid of. And if it's just a once-off headache, then usually this is not considered chronic, and something could have triggered it. But when you have chronic headaches that keep coming at the same time of the day or same time of the year and not easily resolved, then this type of investigation has to be done to investigate, to determine the causes of these headaches, and then each individual cause has to be treated. So if one of the causes is high blood pressure, then the high blood pressure is what needs to be treated, as well as you can provide some nausea. You could give headache tea for the time being. There may be vata involved, there may be sleep problems involved. There could be substances like coffee or chocolate that could be aggravating and making this headache. So these causes all need to be identified and all need to be removed. So the person has taken away these stimulants, this chocolate, this coffee. You may have to give them herbs to help them sleep, because that could be one of the causes. And then, of course, it could be pitta or vata involved as well. So it could be many causes. You could even have up to 4 or 5 different causes, and this is why people have quite a lot of difficulty in treating headaches, is because they're just trying to treat the headache and not identify the causes. So if you need any assistance or help in identifying the causes of your migraine headache or chronic headache, don't hesitate to contact me, and I have the paperwork that you would complete in advance that would help me to see and identify this cause, probably just from my forms, and then through questioning I would identify exactly what the multiple causes are, and then I would have a treatment for each cause. And often the person themselves is part of the cause. For example, their lifestyle, staying up too late, not sleeping deep, but even something as simple as overworking, stressing, these are all could be lifestyle causes. So it gets tricky. You have to ask the person to slow down, relax, not push themselves, take more time off and sleep, go to bed earlier. Even some people have told me that, they're urinating multiple times at night, then they don't sleep well, then they they get a headache in the morning. So they have to have the coffee, and if they don't have the coffee, the headache's really bad. So, you can see how, and then they're on blood pressure medication. So, and anxiety medication. So you can see you can have multiple causes there: blood pressure, anxiety, poor sleep, urination at night, and coffee. So you got 5-6. You can have 5-6 causes right away. So this is the trick. But a headache, to summarize, is really not a disease. It's a symptom. It's an alarm going off in your body telling you have a problem. I mean, if you hear the alarm going off in the neighbor's house, you don't know. It could be a fire, it could be a flood, it could be a robbery. You don't know what it is. The alarm is just sounding to let you know that there's an emergency. You need to stop what you're doing and address it. And that's basically what a headache is. So when you do have a headache, just taking pain medicine, just taking Tylenol is not addressing the cause. That's like just turning the alarm off for a few more hours. Keep turning the alarm off. But meanwhile, the house could be burning, tissue could be damaged in the body, neurological system could need support. But if you keep taking painkillers or aspirin, then you're not addressing these causes. And then, of course, it creates the dependence on the aspirin or painkiller, and the underlying causes are not resolved. So don't just turn the alarm off. Investigate, spend the time, face the facts, face the reality of what the causes are for your headache, and start to work on those individual causes. And of course, these herbs that I provide here are just make it much easier. If I want to cool somebody's body down quickly, I can do it with the herbs. If I want to improve circulation up to the head, because poor circulation is another cause of headaches. That's why these type of people, they have to lie down. But in that case, we have circulation tea, we have high blood pressure herbs, we have heart tea, we have nervines, we have sleeping herbs, we have herbs for congestion and respiratory problems. So, from an herbalist point of view, we can address these causes quickly with herbal substances and get fast results. But even on your own, you can identify these causes and start to work on them, start to change your life, try to change your lifestyle. And most people, they know many of the causes. They know it's through tension. They know it's due to anger. They know that it's due to poor sleep. They know it's because of the coffee or some foods or food allergies. So we sometimes know, but we don't address these causes. So I encourage you to do so, and let me know if I can assist you. And I hope this helped you to better understand the causes and the potential to treat these chronic headaches. Thank you very much, ladies and gentlemen.